Podiatry, it is a medical specialty that deals with the treatment, the diagnosis of food disorders. Now, have you ever heard of that? I am very sure no, or maybe a little. But don't worry, you're in the right place because this is Medic Lounge here on High Impact Television, and we are about to teach you an aspect of medicine that you might not be familiar with. And in the studio, of course, we have a seasoned specialist. Now, in the studio with us, we have Dr. Babajide Ogunlano, and he's a consultant podiatrist, wound care specialist, and foot and ankle surgeon in Houston, Texas. So what exactly is podiatry? Okay,
so good morning, everyone. Podiatric medicine is actually a subspecialty of medicine. It requires training to become a foot and ankle specialist. So we go through almost a parallel path as the regular allopathic medical student in the first 2 years of our training, and then after that, then we go into our specialty. And then it covers a wide range of specialty also. Like within podiatric medicine, there are wound care specialists, there are surgeons, there are people who are biomechanic experts. Those are the ones that deal with the way we walk and how it affects the foot. There are those that are also trained in wound care in terms of hyperbaric oxygen, using it to treat the diabetic foot as a specialty. So it's, and also sports medicine is another area.
Oh, yes, yes.
Because if you think about our soccer players, our basketball players, they use their feet a lot. A lot of them will have injuries to their ankle, their foot. Whether it's anything that has to do with the foot and ankle, that falls in the purview of podiatric medicine.
Okay, so when does one set out to seek the help of a podiatrist? Is it when there is a problem or there is a preventive aspect of it?
Depending on what you have as a risk factor.
Okay.
So there are people who are diabetics, for example, they tend to have issues that show up in the feet. So for those types of individuals or patients, they need to be seen more frequently, whether it's on a preventive side, to know that diabetes affects the feet and what they need to do to prevent complications. Regular people who do not have diabetes or don't have a family history of diabetes, it's only when things go wrong that they typically come in. Now, we do have patients who have deformities in their feet, For example, people with clubfoot, people with deformity where they have bunions. This is where they have a prominence on the side.
Like shootouts like this?
Yeah, hammer toes, where the toes are contracted. Those are people that need to be seen because those are risk factors for developing corns and calluses.
For bunions especially, I've seen quite a number of it around. It's almost like it's a normal thing. And then I've heard that wearing heels excessively can predispose to that. So is it true, first? And number two, if it's not, what are the risk factors for bunions and hermatos?
Okay, so the foot bunion is a biomechanical abnormality. It's really not supposed to be there. So people who are flat-footed, you notice some people, they have skinny feet, and you have some people who have wide feet.
Yeah.
The ones that have the bunion, you notice where, the bumps will be sticking out on the side. Sometimes they have toes that grip, because of instability. Like the body tries to, when you're walking, it has to grip to hold you, for you to be able to stay, otherwise you feel unstable. So it's not normal. And then when you now put that into high-heeled shoes, for example, it's really not the high heel that's the problem. It's the fact that the shape of the shoe.
Oh.
So when you have a shoe that is narrow
like
at the point, V-shaped, think about your toe that's wide.
And then you're constricting it.
Constricting it makes it worse. It exacerbates it. And then if the patient is diabetic, that area becomes a pressure point. And it's from the shoe gear that they will get an opening, a blister will form. If they don't address it, then it becomes a wound that takes a long time to heal. The same thing with the hammer toes. You're trying to squeeze all those toes in that space. And that's one of the reasons why we recommend a wider toe bar. But to ladies, it's not as pretty.
Oh, well, sometimes those ones are more fashionable and pretty.
Right. If you're healthy and you can feel that it's uncomfortable. You notice a lot of times people go to parties, they have a slippers in their bag.
Some sort of insurance.
So when they're taking pictures, they wear the heels, but then once
they sleep back into that for comfort. So you're advising that?
Yes, my wife does that. People who have bunions that doesn't hurt, if they've learned how to use the right shoe gear,
Okay.
So anywhere you have pain, it's your body's way of telling you something is wrong,
wrong.
and you need to have it checked out. So it's not normal for you to be walking around with pain. Now, the caveat to that is, you know, if someone is neuropathic and they can't feel it, so they keep walking on it, somebody needs to be checking their feet for that, or they themselves need to, if you can't feel it in your foot, you use your hands to feel. If there's an area that's hard, that needs to be shaved down.
So let's steer the conversation a little bit differently. Now, podiatry in Nigeria, it's not a very common practice.
It's not.
Why is that?
That's a good question. There's no curriculum yet developed or a training program for podiatry. The funny thing is, in the diaspora, in the US, for example, we have a lot of people of Nigerian descent, you know,
That are practicing
that are going to school for it, and they're in private practice. Some are in academia, and a lot of them want to, you know, help in one way or the other to help with, you know, maybe developing a program here or coming in periodically to offer our services, you know, the university teaching hospitals or the general hospital settings, you know. But there's a lot of bureaucracy sometimes, you know, over here in terms of trying to even get in the door, because some people feel it's a competition, and it shouldn't really be.
So what are the routine care like? What should a person do such that it wouldn't have to grow to an extent where they have to cut it off?
In terms of prevention, let's say before any problem arises, but you notice an area of your foot, your skin is supposed to be soft and supple.
Yeah.
So if you start feeling an area of corns, calluses, hard areas, you have toenails that are digging, you know, long, and they're digging into the sides of the toes, those are areas that need to be addressed, you know, as soon as possible. It doesn't mean it's an emergency, but there should be some sense of urgency that if my nail is too thick and I have fungus in the toenails, if my skin is too dry, you know, and I'm not moisturizing it long enough, if I have calluses building up and I'm wearing tight shoes, those are lifestyle modifications that you can do. You get someone to shave it down, the corns and calluses, the toenails that are thickened, you get someone to, you know, trim it down. You know, those are things that we do on a routine basis to prevent problems.
So I hope you've heard that you should take care of your foot, actually. You know, you shouldn't wait till you are feeling extra pain in your foot and maybe when you're no longer feeling anything. So routinely, please check yourself, go to the hospital, seek the help of a specialist, and you will be fine. As I always say, health is wealth. And don't forget to tune in always to MediClounge, because here we're always informing you about your health. Thank you very much once again. My name is Oluwaseun Olusegun.